Welcome to MadeToBeWhole. Stay tuned for our conversation with Molly Ratay, a Babesia Lyme survivor and one of our new health coaches.
MadeToBeWhole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on MadeToBeWhole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
Welcome back to the show, and thank you, Molly, very much for joining us and sharing your story.
It's good to be here. I'm excited to be here.
So would you tell everyone a little bit about your story? When did your symptoms start? What has that long, difficult path been like?
Yeah, of course. It has been a long and difficult journey. I would say I got diagnosed in 2022, so pretty recently, but the symptoms go back countless years, probably into my late teenage years, and affected every aspect of my life. So unbeknownst to me, it was Lyme disease, and I'm so glad that, I found you and the system and the clinic, and we worked really hard to figure a lot out, and now I'm in remission, and I'm better, and I have a new life ahead of me. So I'm so excited to be here. I'm excited to be a part of the journey.
Would you tell people a little bit, if you don't mind, about your symptoms? Specifically, you had some really intense Babesia symptoms. Babesia, I would say, was like the big elephant in the room in your case. Can you describe a little of that for people?
Yeah, so before I was diagnosed, I would have constant fevers. I would have night sweats where I was changing my clothes 3 or 4 times a night, tinglings in my extremities, and constant headaches, buzzing in my whole entire body, in my ears, the ringing, pretty much every neurological symptom that you could think of. And I had no idea what it was. I was, falsely diagnosed by many, many, many doctors. And, things just happened and they rolled the right way. And thankfully, we were diagnosed successfully and we were able to start treatment. But those symptoms, Babesia symptoms, were the worst, but along with other symptoms, I had miscarriages, I didn't have regular cycles, I was losing weight, I didn't eat, I had no appetite, constant stomach aches, again, the constant fevers, the depression, anxiety, the anger. It's debilitating, completely life-altering and debilitating.
You were very, head to toe sick. I mean, that's pretty clear from your description, but I'm also thinking about, the deep pain, the lymph nodes. You would get these enormous lymph nodes. I mean, just anxiety that wasn't typical for you. I mean, it doesn't seem like there was a system of your body that wasn't stirred up by this.
No, and the pain, like you said, the pain was unbearable, pretty much. So, and it only got worse. The past couple of years were the worst. I was in bed for days and weeks at a time due to pain, and that's actually what got me into the doctors, and they tested me for severe arthritis. And being only 36 at the time, that's not normal for a 36-year-old to have that severe of arthritis that was caused by the years and years and years of untreated Lyme.
And when did you personally figure out, this could be infection related, I need to look down this path? What clued you into that?
I was an avid runner, and I was like, I thought, maybe I twisted my ankle or something, but I hadn't, and I knew my body well enough over the years of being sick. I knew how my body was, and it was about 2 or 3 months of severe, unable to walk ankle pain, without swelling, without anything black and blue. There was nothing. I thought it was bone cancer, to be honest. So I went into the doctor, and they tested me for Lyme, tested positive.
Awesome. And was that a PCP or the ER?
That was my primary care, and
Kudos.
I say thank you to them, but the way they dragged me over the years, it's something that I will probably never go back to them.
We're trying to help people avoid. I think that's one of the challenges with like running the practice, and then you've been involved with these changes we're trying to get going for people, is we can't do the things the same as other places. You know, they have restrictions, by the facility or the company, but also just the fact that we have to keep investing in lifelong learning. You know, if we don't keep going to conferences and doing continuing education and learning new things, we're not going to get there. I can't rely on what I learned in school. You can't just say, oh, I'm going to take this coaching class and then I'm done. It's continually equipping ourselves to help people on the journey. And we were talking before the show about how it's kind of like there's layers of an onion, and you don't know until you start peeling how many layers are in each onion. I mean, some people can have intense symptoms and it doesn't take that long. They don't maybe have as many other things going on underneath, or maybe it hasn't been as many years of illness, or maybe their genetics are who knows, you know, but we don't always know. So it's hard when people say, well, what are your protocols? How long does it take to get better? It depends. It depends. And you've been so, I mean, I know I've told you many times over the years, you're working too hard to feel this bad. You're working too hard to feel this bad because you did everything, and like the symptoms were severe, but the treatment was like disabling at times too. And then you ended up going out of state for some like inpatient intensive treatment that really helped you turn the corner, but is also giving us a vision for the sorts of things we could offer in our office so people don't have to go to Florida or Mexico or Germany. What were the extras that helped you turn the corner?
Oh, I'm so excited for where the AHP clinic is going, because the modalities that I did, so you have just talked about how we're getting plasmapheresis on board, and I 100% believe that what put me in remission, what helped me, was the IV treatments like the plasmapheresis and the different modalities like that. And with this clinic getting those things, people are going to be able to come from Ohio and Pennsylvania and surrounding states to be getting these treatments, and it'll be a faster turnaround. It'll be a faster way to get them healthy. And I cannot even tell you how excited I am for this clinic. It's amazing.
And I know I've said this to you, but I'll say it on air too. I wish your journey would have been more straightforward and you would have got better faster. But I'm grateful that it's put you in a position to help us have this come to life, you know, to Absolutely. Say, okay, here's what it was like on the receiving end with the scheduling and the coordination of it all, because I know that going and being inpatient to the intensive treatment was not cheap. Is that correct?
Yeah, but you know, that gives me a better way to be able to talk to patients. It's the money doesn't matter. I mean, truly for your health, we were made to be whole, like you say all the time, and no matter how we get there, we're going to get you there, but you got to be able to want it. You have to want it.
And there's no way, when somebody has lots of layers to their onion, there's not a cheap shortcut. You know, no. we've looked, and it's not, because I know that people outside of the system will sometimes say, oh, you're just greedy, you want to keep people sick, you just want their money. And that's not really true. I want to be able to pay my staff. I want to be able to like meet my expenses and be a sustainable business. But these services aren't cheap to deliver, and patients are so complex. We want to be able to give them the time that they need.
Right, and like we cannot put a price on our health, but what they want is, some people want it's going to be a Band-Aid. Yeah. And we don't want them to have a Band-Aid. We want them to have lifelong health, and we want them to get better.
Well, because honestly, it's my goal that I eventually, if I see my patients, it's because I ran into them at Walmart, not because they're in my clinic. I don't want patients for life. I want people to get better and move on. And I think that's...
And there's so many people that are going to need us that we want, hello, goodbye, we've helped you. We want to keep that circle turning.
Right. If people think about, maybe you can compare this with your experience some other places. I know sometimes we're not as quick as we'd like to be getting back to people. That's part of why we're bringing the health coaches on, so we've got more people to get back to people faster. But I don't know of other offices where you call and somebody spends 30 minutes on the phone with you. Yeah, and we have multiple calls a day that take at least that long because so many people are in crisis and are struggling, and we want to be able to give that level of service. And I love the idea that all our coaches we're also calling peer support specialists, because you've walked the walk. You get it. It's not just words on a paper. You know how this impacts your relationships, your work, your everything. You can't say, "Oh, Molly, you just need to exercise." You were exercising. Like
Right.
you know that was taken away from you by these illnesses. It's not just a matter of willpower. How did other people's, I guess, attitudes and interactions with you throughout this, whether it be healthcare professionals, but also family, friends, coworkers, like how can somebody else impact someone's journey for good or bad by the way they interact with them?
Oh, that's a good question. I've had a lot on both sides. A lot of the negative, making it, and a lot of positive interactions. I know that what would have helped me in the beginning is to have somebody to talk to,
Right.
is to have somebody who has walked this walk, that has been through what I've been through, that I can sit down and I could cry to, I can talk to, I can ask questions, and I didn't have any of that. And even when I went out of state, it was still a 24-hour turnaround, and I wanted somebody to talk to. And I think the ability to have somebody who's been in my shoes, who has been as sick, to talk to them, and just that would in and of itself make healing easier and even faster in some cases, because you need a positive outlook. And if you don't have that, there's not going to be, it's a poor get-go.
Well, and how do you balance being honest with like how much this sucks, because it's really, really hard, and you can't minimize the fact that, oh, you have drenching night sweats and can't put on weight and you're in horrible pain, but also having a positive outlook. How do you leave space for these two competing things?
Well, I think my journey, I leaned on God. I leaned on God the whole time, and if I didn't, I wouldn't be where I am today. But now that I have gone through it, I can look back and say, I'm so excited because I know you can get better. I know people can get better, and I want to be there to help you. I want to see you through it, and I want to be excited with you when you are better. And I want you to understand, like, yes, it was horrible, and it was hard, and there was a lot of tears and a lot of anger, but now that I'm better, I have my life back, and I've done these things that now we're going to be offering. It's so exciting. It's so exciting.
It's awesome to be able to take your journey and your healing, and to the whole beauty from ashes concept. Yes, this isn't what I've chosen, but through what we make it through, God can use us to help lift and heal other people in a way that we just couldn't. You could be compassionate and kind, but it's so different when you've walked it. And it's so much easier though to learn. I think a lot about how much harder it would be to learn these things if I didn't have the illnesses, or my kids didn't, if they weren't that personally relevant to me. They'd be words on a page. I'd be trying to learn and understand, but it's just a whole different type of education.
Yeah, and those people in my life, like, were started off kind of with that negative, and the whole weren't very helpful. They didn't live it. They didn't understand it. They didn't want to. But then as time went on, oh my gosh, like, this is a real thing. This is, like, we see it. We know. We're going to get her better. It can happen. And with that, that's what helped a lot.
How did you cope emotionally in the moment with people who were doubters or unsupportive or even antagonistic?
I knew how I felt. I
Right.
knew that I had a very severe illness, and have. And I think that I just felt kind of bad for them. I felt bad that they couldn't open their eyes and see that this is a real illness. And it's not cancer. No, it's not something like that people are so familiar with. But I think that a part of me, just being a teacher, being an educator, being already an emotional support system for many, many people, I felt bad. It was hard, but I had people to lean on, my husband, my family. I had many people to lean on. And then I was able to kind of just push it away, even though it hurt.
Sure.
But again, I didn't have, a health coach to talk to and be like, what do I do with these people? And then been there, I'm going to be able to help people a lot by giving them that support.
Well, and just to hear someone reassure you too, in addition to your provider, no, this is normal. I mean, just even the concept of hertzing, which is so bizarre. Hey, we've got this treatment that's going to get you better. It's going to make you feel real bad first. And if that happens, that means it's working. Like that is really weird. I mean, it's really, really weird. But just having someone who can say, no, it's not just Krista who's telling you this or another provider. I've been there. I promise it gets better. But also to help figure out which things. We don't want people to be too stoic. We want them to let us know when things are going on so we can help walk them through. But just the reassurance of, okay, is this something I need to get help for, or is this something I can push through? Helping to have some perspective that it's worth it and it will end.
Yeah, and I'm not going to doctor after doctor to hear them say, oh, well, you could try this, and paying for all these doctor visits when they don't know. They don't know because they haven't been trained. They don't know because they don't want to know. And then just skip over that to somebody who's been there and lived it, and that can really help you.
That's awesome. So with the health coach training specifically that you're finishing now, which things have you found most interesting there that you think you're excited to share with people that you can work with them on?
I think a lot of things that I'm excited to start out patients with talking about is their nutrition, their supplements, and their gut health. I think those things are so important in getting better, and being able to talk to them and been through that journey myself, that is this thing that I'm going to be like, listen, this is important. You need to stick with it, especially getting your gut health fixed before we start getting you better. That's going to be key. And being able to understand that from different medical perspectives in my health coach training and walking it and seeing it, it's all coming together with this is so important for people to understand.
In reality, even though the path here isn't easy, people who do all of these things, if you stick with those changes, you're actually going to be healthier down the road than if this hadn't happened to you. You can't take your health for granted, but if you really learn about inflammation in your gut and nutrients, and that's something that's a life goal because you want to get healthy and stay healthy, you're going to have a few rough years, sure, but you're going to be ahead of the game in the long run.
Yeah, and your Lyme treatment or whatever treatment you're going through is going to be that much better for you in the long run.
One of the other unique, very cool things that I'm excited about that you're going to be able to offer is you have worked for years in education, and so you've got kind of a unique perspective on when we have parents who are taking care of kids who have these issues, helping them figure out the best path for them educationally, that you can actually meet with them as an educational consultant, whether it's how to get accommodations at school, if public school is not maybe the best fit for your child at this time, and just so many different things from an insider's perspective. Can you share a little about what you envision for that and what you can help parents with?
Yeah, I have spent almost 20 years in the public school system, and I know it very well. And I know that for some of our ill patients, young patients, that it might not be the best fit for them, because I know that public schools don't have a lot to say on that matter. They don't do a lot for our children, and I know that I'll be able to talk to parents because I actually have 2 young ones myself going through Lyme and being treated for Lyme, and I know that their emotions, their needs are different from children who don't have this chronic illness and this illness. So I will be excited to talk to parents, and I've been there, I'm living it, I've seen schools deal with it, and sometimes it's not what is going to be best for the patient. So I think I'm going to be able to advocate for that very well and be able to lead them on a path that is best for them.
And I think that's key, is just figuring out this individual child and family and their needs and what's going to work for this situation. And sometimes there's this idea of, no, the schools should do this and I'm going to fight to get my kid what they want, but not at the expense of your kid. Because if they're not equipped and don't have the resources and knowledge to provide it, and you've got a child who's suffering now, you kind of have to figure out, well, what do they what do they need now? I don't need to die on this hill. I need to get my child what they need. And I think now, I mean, if you think about homeschool being easier, but there's so many online public schools that can help you, or if you have a district that's willing to work with you, that's great. There's a few that are, but a lot of them, it's kind of the same things you've dealt with as an adult, but just in a school setting. Well, they just need to see a psychiatrist. They're just anxious. They're anxious because their brain's inflamed and because they feel terrible and you don't believe them. So that's fueling the anxiety even more.
Right. And I think that for like the path and the future of this clinic, I think that we could even provide tutors who are familiar with Lyme and chronic illness and really be able to help our younger patients who are in school. And I think that is something that this clinic is going to be going forward with, and I think it's great.
Well, and I think taking a little of the burden off parents. We don't ever want to, because we can't take the place of parents, but say, okay, there's only so much you, mom and dad, can handle. What services could we provide to take some of this weight off of your plate? Because when you're living in the battlefield, and you're just surviving day to day, you don't have time to put together beautifully written letters or just some of these extra things that you need. If somebody who's been there can help you navigate it. And again, to be affirming, your child is not a failure. It's not okay. They can still have a good and compelling future even if they don't have this traditional path. That's totally fine. Right. Our school system has served people well for a long time, but it's not the best setup for everyone. It's really not. I 100%
agree. Yeah. No,
well, and in reality, I think about my youngest when he was still in public school. I mean, this poor counselor, he'd go talk to her for like 45 minutes at a time, and he had all these intense emotions. And she's scratching her head, and I'm sure she's thinking, like, this kid's got a great life. She's got kids who don't have food to eat, and there's no clue where his emotions are coming from because there hasn't been trauma, but it's inflammation and all these things that I know she wasn't equipped to deal with, but it was interfering with his ability to function and learn.
Absolutely.
And we were so much happier once we just said, yeah, this isn't working anymore.
Right. And I think parents are going to need to hear those options.
Right. And to hear about other kids, because ultimately this success, I guess I'll back up. Ultimately, this success is not just that your child's well, but that they're still alive. I tell my kids that a lot because with this whole encephalitis piece of it, there's a really high suicide rate. And when my youngest is like, am I doing enough? I say, your job is to not kill yourself. I'm very straightforward. Like that is our goal right now. Yes, I want a bigger future for that. But right now our goal is to keep you alive. I don't care about school. I don't care about graduation. I don't care about any of that. I care about you being alive. And once we can get, this kid really needs plasmapheresis. So once we get that to the clinic, some of these last puzzle pieces in place, then those things, you'll catch up naturally. It's not going to be that hard. And I also feel like I look at my kids and what they've quote unquote missed educationally, but what they've developed as far as being compassionate, giving individuals, that's huge. I mean, that's something you cannot learn in a classroom setting. And I'm proud of those things because I think that's going to be more key to a successful life in reality.
Absolutely. And the fact that like we have the ability to talk to parents this way and to make sure that they understand these things is amazing. And if I had, my children aren't old enough yet, so I still have these options, but if they were older, I would want somebody to discuss this with.
Right. And to hold your hand and say it's going to be okay. Yeah. It's going to be okay. You don't need to worry about, will they get into this school or that school or what kind of a career. It doesn't matter. It certainly doesn't matter if they're dead, but it doesn't matter at all if they're suffering. You've got to focus on right now, like, how do I keep this child safe? How do I give them the time and space to heal? And for them to know that they're loved and safe just as they are. Like, your approval doesn't depend on their accomplishments because that's just not that important. It's just not that important. Right. So what about, we've had, as people have heard about the membership program starting, some questions coming in just to clarify for people, and then we can talk. So the membership is for people who are existing patients who aren't in foundations. If you're in foundations, you don't do membership until afterwards. There's 4 tiers because I want to make the transition really easy for our existing patients. If you pay for the first year up front, it's 50% off, which means if you use everything that could potentially come with that membership, we're not just not making money, we're actually losing money, but that's not the point of the membership. The point of the membership is to help us say, okay, how can we be organized as a clinic, account for what level of need individual patients have, and then have enough staff to meet those needs? You know, we have a lot of patients, because of everything going on, they just need more reassurance, more direction, more frequent treatment changes, more touch points, and I want to have a system that's built in that can accommodate for that. So the way I thought we could do it the most fairly is for the membership levels to correlate with your level of need. So if there's somebody who doesn't have high needs, say they finished treatment, they are in remission, they just want to hold on as a patient, it's $25 a month or $250 a year. But if you pay the whole year first up front by June 15, it's $125, which is like $20.80 a month. So it's more like, okay, that's a placeholder, making sure we save room for you at our practice and then you still have access to our services, versus if somebody wants to talk to their coach every week, that's a higher level of need. So the cost goes up, but we're trying to make sure we can give people what they need, have the right staff, and make sure we're getting back to you quicker. Make sure we're accounting for if Molly has a lot of patients that have high need and she's really busy, we're going to say, okay, we're not going to give Molly more patients to coach. We're going to get another coach on board, and that sort of thing. What would you say to people who might have like concerns or questions about the change in the membership program? Is it a money grab? Is it us trying to keep people sick? Those are some of the things that we've been accused of. How would you address those concerns?
I mean, I understand where people are coming from, especially the people that haven't been through the full treatment. And so going back to me, it's a lot of money to get better. You can't put a price on getting better. But the fact that you are allowing for half off by, June 15th?
15th, yeah.
Is just insane to me. Like, I would grab that so fast, because you are then putting your place in to where we are getting these modalities to put in place for you. You are going to be able to do these in a very nice period of time and get better faster. And You're not going to be drawn out. It's not going to be paying us over the years and years and years. You're going to be able to pay it in front. You're going to do it. You're going to get better. You're going to do your modalities, your treatments, talk to your health coach, and it's going to be over. You're going to be better. You're going to then drop down to the lower level where you might need to talk to us once or twice a year, because You're better, which is fantastic. And I think that I would tell people, like, since I've done it, I would do it 100 times over again, because I never thought I would be better and feel better. And the fact that I do, I would 100% be pushing this, because it's allowing you to have everything you need in this clinic up front. We're working for you.
And the faster responses too. We so like the portal, most practices have a portal. You can message people in the portal. So just this morning, I've already spent 2 hours going through portal messages because it's an admin day, and I still have 10 left. And so just to give people perspective, I'm not complaining, but if I'm buried and I've got like high acuity patients in the office and I've got 20 or 30 portal messages and I've got messages from people that have called in, not everything's going to get back to as quick as I would like to. And then sometimes some things that really should have been gotten back to right away slip through the cracks. So the whole idea of the coaches too is a lot of the stuff I'm doing in the portal, they can take care of. But if there's something that really needs taken care of that day, Molly can come and say, hey, Krista, I really think you need to look at this before you leave, or what can we do to help so-and-so. So we're really hoping the process not only gets you more contact, but better contact, faster results, and somewhat else to help keep track of everything going on with you in your journey, because it is so layered. It's not like, oh, you have diabetes and you take this one medicine and come back every 6 months for a refill and you'll be fine. Diabetes isn't that straightforward either, but this becomes even more nuanced, because, all right, what's going on with your inflammation and your nutrients and your immune system and the infection treatment, and then just the way it impacts your brain makes it so much harder to process and manage, because you feel afraid, because of inflammation and because it's new and scary.
Yeah, and I would say that these packages are giving us the chance to work fast, like you said, faster for you. We're going to be working for you and able to get back to you sooner, get the things you need, get your labs, do your modalities. We'll be able to treat you in office, like say when you need treated, because we're being trained in those different modalities here at the office as well. So the payment is just it's what you're going to need. It's not something that we are taking from you. We're not taking advantage of anybody.
It's paying for the service you're receiving. It's just kind of like you go to your mechanic, and how much you pay depends largely. It's partly the cost of the parts, but it's how long it took. How hard was that part of the car to get to? I don't know. I'm not a mechanic, but we know that labor is time dependent, and it works that way with other professions. And we're just trying to build it in a way, even though it's so different from the insurance-based system, but we have to do things that make us sustainable, and we have to account for our time. One of the things people might not know, if you work in an insurance-based system, not only do you get you're kind of supported by other specialties and disciplines and part of this big piece. But like vaccinations, somebody who has more patients who get more vaccines, they get bonuses. There's financial incentive for doing things and lining people's pockets for doing things that we don't do. So I can't say, well, I only spent 15 minutes with them, but I can bill for really high complexity and make this cost more. Or there's just all these games that we don't play. And so it's transparent. And really, even as far as our visits, the cost really just has to do with how much time it takes. And that's in the patient's court. It partly depends on how sick you are, but I'm not going to sit there and talk to you about my theoretical golf game to kill time so that I get an hour's worth of payout. If we're done at 45 minutes or 30 minutes, that's what you pay for. If it takes an hour, that's what you pay for. We can work around it. But if we can front load you with the right support, I'm also hopeful that it will save people, because it costs less to spend time with a coach than with me. And if the coach can meet those needs, you won't necessarily need to see me as often. And so I don't think in the long run the expense is going to be higher. I know it is a little front loaded and it's a little different, but my goal really in building foundations and the membership and bringing in these modalities is how can we get people better faster? How can we make it more cost effective? And how can we make it easier for them to decide? And some of this bundling is just because it's so hard to make decisions when you have brain fog. But we know from experience, if we don't figure out your nutrients, you're not going to get there.
Well, I think that's a good point that you said there. If we don't figure out, I think that this is allowing us to 100% treat the patient like their name, not a number. And right. I think once they understand that we're working for you. You're not just a number to us. You're Molly Ratay. You are Krista. You are, and we could figure out exactly what you need. You're not a number to us. And I think this is going to be able to help us.
And it's okay if your journey, I know you've learned this, but I guess some people are always comparing their journey to other people's journeys. They want it to match up. But from my experience, nobody's journeys look the same. Even in my house with a bunch of sick people who share genes and have a lot of the same infections, there's some overlap, but it's different. And what's worked for one kid or my husband hasn't worked for someone else. And so that personalization is so critical. And if it takes longer for you than it did for someone else, it doesn't mean you're not going to get there. It means there's something we still need to find out. And so we don't have all the answers, but we will always keep looking for answers. We will keep looking.
Right.
So, what advice would you give to someone who is early in the treatment or on the fence about membership or foundations or making an investment in their health, whether it's here or somewhere else? What would your advice be to someone who's early in that stage of the game where it just seems overwhelming and the cost is overwhelming and you want a fast fix, because that's how it's supposed to be, right?
Yeah. People, we live with the idea of we want it to be fixed fast. And gone through everything I've been through, I would say, you know what, this is going to give you everything that you're going to need. And it is scary. It's a lot, but how do you feel now and how do you want to feel?
Right.
And we're going to get you there.
Right. And not give up on you. That's the big thing. Don't give up on yourself. We don't give up on you. We hope you're someone who gets better quick, but for a lot of people it's longer than we would like. And trust me, anything we can do to help people turn the corner faster, that's what we want. But slow and steady will win the race. And I think having bigger things than yourself to live for too, like you said, having your faith to lean on, having your family, knowing this is all encompassing right now, but it's not all there is to life. There's something beyond this haze that you're in. I've thought sometimes about in Psalms where it's, yea, though I walk through the valley of the shadow of death. I thought, no, with these illnesses, it's like, yea, though I crawl through the valley of the shadow of death, or I lay languishing in the valley of the shadow of death, is what it feels sometimes like. I'm not getting out of here, but you will. It's just a little at a time, and then sometimes you think you're never going to get there, and you wake up one day and you've turned a corner. It's like you've been pushing against a wall and it moves finally, and all that pushing did matter. You just didn't feel the progress until it was time, and things shifted. So there's always hope. Any parting words of advice or encouragement or wisdom?
No, I just think that I am so excited for where the clinic is going, and I'm so excited for everybody that's on this journey. And if choosing a membership is going to get you what you need from us, and it's going to be really great, and it's a lot to look forward to.
Awesome. All right. Thank you, Molly, and thank you to everyone for listening. And remember to have hope, because you were made to be whole. If you're our patient and you have questions, don't reach out to the internet, reach out to us, and we'll help walk you through it. Take care.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.